Okay, I could say this and my husband George would love it if it were in there. Not listening to my husband caused all this. I should have listened better. We really came back to our home. We had been away for a couple of weeks. We were getting ready for that big snowstorm. And I had purchased all my groceries at Publix, and I insisted that they put them in a brown paper sack, which is not a good idea. When you're carrying a brown paper sack, you really can't see like your feet and how you're clearing things. And so I failed to clear a brick step with that foot, and I basically tripped onto my front porch. And trying not to let the bag go, which I ultimately did do, I put my hands out and tried to break the fall. And this was the arm that just took all the pressure right into the shoulder.
Yeah, so Maryanne came into the clinic, and she happened to know one of our partners, and her son is also an orthopedic surgeon. She had quite the fall that ended up having a bad fracture of her shoulder. I'd seen her previously on her, and she had a bad shoulder to begin with, but then it got much worse after her fall. And so I saw her after she went to the emergency department, and she was diagnosed with a bad proximal humerus fracture, which essentially means that the ball was broken into multiple pieces. And at that point, we had to figure out a solution to get her function back. When she has a fracture of the proximal humerus, or that ball is broken in many pieces, there's a couple different ways we can treat this. And so one is you can treat it without an operation. The second way, you can treat this with plate and screws and fix the fracture. And so I'd previously diagnosed her with some osteoarthritis in the shoulder, and she had some issues. But the last option is to replace the shoulder and to do the reverse shoulder replacement, which to some patients can be quite shocking right away. And because now you have a normal shoulder, have an injury, and have a fracture, and now you're talking about a shoulder replacement. But in her situation, given the fact that she had some pain previously, as well as the fracture characteristics, that ultimately was the best option for her.
Part of our conversation, he had told me that there was a chance that my range of motion would perhaps not really go beyond this. And I had said this to Irina, was, if I don't fix this, I won't ever be able to pick up a grandchild if I have grandchildren, or I won't be able to reach for a coffee cup, or could I even take Thanksgiving dinner out of the oven? What part of normal would I get back?
Yeah, so the reverse shoulder replacement, or reverse shoulder arthroplasty, is when you replace the shoulder, and so now you take the shoulder joint out, and instead of where the socket is, so the shoulder is a ball in a socket, and where the socket is, I now put a ball. And where that ball was, in your case, it was fractured, so I take that fractured ball out, or the humeral head, and I replace it with a socket. So I reverse the order, and that's why it's called the reverse shoulder replacement. And what that does is it restores stability to the shoulder, and it restores forward elevation, as well as allows your deltoid to do a lot of the work. So it's typically used in patients' conditions that have rotator cuff deficiency. So when you have an incompetent rotator cuff, or in your case, you had fractured the pieces of bone containing the rotator cuff, so it was essentially incompetent. That's why we do the reverse shoulder replacement. But it's typically an overnight stay or a same-day surgery, and an incision in the front of the shoulder. And it usually is about 85% of the recovery happens within the first 6 months, but patients don't plateau really to the 12 to 24 months. So it takes a fair amount of rehab to get over shoulder surgery, and persistence.
And patience.
That's exactly right.
It really does. So when I first went to, after some of my PT with Dr. Brolin, I had lifted my arm here, and you were like, remember how happy you were?
Yeah, absolutely.
And then I just was like, are you kidding?
Yeah.
So here I am, really probably with more range of motion. And I will say, I'm thinking about what my PT says, don't shrug, because you don't want to shrug to do that in the shoulder. But yeah, I mean, really, I probably have better range of motion now than before, and the outside motion was good, and the over the head motion was good. And
the biggest factor is really your motivation. And so I tell all the patients, I do the easy part, you do the hard part, because rehab from shoulder can be difficult, and you've been a rock star at that, and that's why you end up with as much function as you've had.
When you get any replacements done, you don't have to use the physical therapy of the surgeon. I could have gone anywhere for physical therapy, and I chose to stay with Campbell because I felt that that was that they knew that Dr. Brolin's protocol, and they kind of knew his path. And I felt that that was just an extension of him. I had no problem scheduling appointments. People gave me cell phone numbers if I had any issues or concerns. And in fact, my physical therapist even checked in on me. I felt that there was really great coordination between all pieces of the staff.